Well, everybody, we're going to go ahead and get things started here. I appreciate everybody taking the time this morning to join and join us on our webinar here, Sell Medicare Products Year-Round with Low-Income Subsidy. Quite honestly, I think outside of our Medicare marketing workshop that we perform, I think this is the most important webinar that we offer here at Flex in regards to Medicare. This gives you the opportunity to sell Medicare year-round to people. Anybody who qualifies for the low-income subsidy, it opens up a year-round continuous open enrollment for them. And it's also a great opportunity to build a contact list moving forward. Somebody may not be eligible for the low-income subsidy, but it gives you an opportunity to talk to them during the annual enrollment period that's going to be coming up around the corner. And now is the time to start prospecting and get out there and look for these people so you can build that list moving forward. Stuff went off the highlight again. All right, come on, there we go. All right, we start every webinar or seminar. We always want to tell you a little bit about who Flex is in case you don't know who we are. We're located in Rosemont, Illinois. We have roughly 100 employees. The company was founded in 1988. We have over 4,500 producers contracted through us. We have three primary business divisions: the general agency, which our Medicare division falls under, benefits administration, and exchange and marketplace services. You can see some of the carriers that we work with as a general agency: Aetna, Blue Cross, United Healthcare, Mutual of Omaha. Those are our primary carriers in the Medicare space, and you can see some of the other carriers we work with in group and individual products as well. On the benefits administration side, that's actually where Flexible Benefit got their start in the industry. Products like flexible spending accounts, HSA, health savings accounts, HR, health reimbursement accounts, COBRA administration, those types of products. That's a big part of what we do here at Flexible Benefit as well. We also have our exchange and marketplace services. This gives employers an opportunity to set up an exchange for individual insurance with their employees. If you need information about that, that's an entirely different topic, but those are available as well here at Flex. The objectives of today's webinar are to identify the features and benefits of the low-income subsidy program, identify the value of assisting LIS-eligible consumers, and this is a key thing that we're going to touch on as we go through the presentation today, why you want to be the person to help these people get enrolled in LIS. Recognize general criteria that may qualify consumers for LIS, and assist consumers in seeking candidacy for LIS. Okay, what is low-income subsidy? You're typically going to hear three terms when people refer to this. Of course, this is low-income subsidy. You're going to hear it referred to as, I just called it, LIS. And most commonly, you're probably going to hear the term extra help. I know with a lot of the clients I've worked with in the past, that's the term I've heard most often from people out in the marketplace. Oh, I get extra help for my prescription coverage. Okay, so you're going to hear that term a lot. Okay, LIS, it's a subsidy program that helps low-income Medicare-eligible consumers save money on their prescription costs. Okay, it's not Medicaid; it's a separate program, and again, you have to be Medicare eligible, obviously, in order to qualify for this particular program. So the Social Security Administration estimates that the average LIS enrollee saves over $4,000 per year on their prescription costs. So we think about the people we're helping in the Medicare space. So many of them living on fixed incomes. A good portion of them survive solely on Social Security income. So if you save somebody $2,000, $3,000, $4,000 a year on their prescription costs, you are a hero to these people. It also gives you the ability as a broker to help them with some other products that they couldn't afford in the past if you can save them this kind of money on their prescription costs. Okay. What are the enrollment opportunities? As I mentioned at the beginning, it gives qualified consumer a continuous election period, and they can change their plan at any time. So the moment somebody becomes qualified for Extra Health or LIS, they're able to select a new plan starting on the 1st of the next month. It could be a Medicare Advantage plan with prescription drug coverage, or it can be just a standalone PDP. And the cool thing about this is if their needs change 4 months later and suddenly they're on some different medications, you can go back and write another plan for that person. So they can continue open enrollment at any time as long as they're qualified for LIS. So this is the key part. This is what opens the door to selling Medicare year-round. Anybody who's qualified, you can write that plan now. You don't have to wait for AEP. So that's the key part of this. All right, what's your role as what are the different roles involved with LIS? The first is it's actually not administered by CMS or Medicare or anything else. It's Social Security Administration that administers this program, okay? They decide who qualifies. They determine the individual's benefit level. And they process the applications for the program. Why is this important? This particular program does not fall under the regular Medicare marketing guidelines. So you're not as restricted in talking about LIS as you are other Medicare marketing opportunities. So you have much more freedom to go out and talk about LIS. So this is huge. Again, it's not through Medicare or CMS, it's through Social Security Administration. Okay, your role as a in this situation, you want to become that trusted advisor to the client. This is what you're really working towards. You're going to help the consumer understand how the LIS program may work for them. You're going to assist consumers in completing the application. You're going to consider the consumers may have unique plan needs based on their limited income and resources. You're going to know that a change in the consumer status may change their eligibility for LIS. We'll get into that a little bit further here in the presentation. Ultimately, this is your goal. You want to become the trusted advisor, because what happens is if you assist them in putting in this application, they'll get their purple letter telling them that they're qualified for the plan, and then immediately after that, you can enroll them in the plan. So you want to assist them in this process and be there for them and be that advisor, because you want to make the commission, obviously. That's what we're all here for at the end of the day. But most importantly, we are helping people with this program. Again, keep in mind that the Social Security Administration says that on average, $4,000 per consumer are saved when they're enrolled in LIS. That is just a huge, huge benefit for these people. Okay, so let's talk a little bit about the features and benefits of the program. Under an LIS qualification, once you receive that from the Social Security Administration, you can Medicare Part D plan premium paid for. Here in Illinois, they cover it's a little over $28 in premium. It'll cover if the plan has an annual deductible. It can cover that. It'll cover prescription, co-insurance, and co-payments. Offer assistance with the other prescription costs. Most importantly, if you're in the program and then you land in the donut hole or the coverage gap, what your co-payments are prior to that remain in the coverage gap. So like everybody else who falls in the coverage gap outside of the program, your costs for your medications do not increase. That's huge as you're coming through the donut hole. And then when you come out the other side of the gap, your payments for your prescriptions will be less than they would be if you weren't in the LIS program. You also can receive assistance with your Part D late enrollment penalties. So for some, that client never signed up for prescription drug coverage and they're suddenly 70 years old and they have prescription needs, they can have that late enrollment penalty covered through the program as well. So there's some huge savings, and again, that's why the average cost, when you think about it, rolls up to being $4,000 a year in savings. Okay. So how does the subsidy help cover the consumer's premium or deductible? It can cover Part D premium in whole or reduce it significantly based on whichever plan they choose. Again, it can cover that annual deductible. insurance and co-payments, prescription costs, and again, as I just talked about, the coverage and the gap. Okay? And as I just mentioned, it can also eliminate that late enrollment penalty. I had a client that I helped last year. We had come for a $26 plan. She called me up 2 months later. Joe, why is my premium $54? It's because 82 years old and had never signed up for a prescription drug plan. In this scenario, if she was LIS eligible, she would not have to pay that additional penalty on her premium. So that's huge. Again, people living on these fixed, tight incomes in retirement, and we're living longer. We need their money last longer. This program is huge for these people. What are some of the qualifications for the LIS program? Okay. You're automatically qualified for the program if you're enrolled in Medicaid, but what happens is you have to either be currently enrolled in a Medicare Part D prescription drug plan or about to enroll. So if you're just turning 65, but you know that this person's going to be living on a limited amount of Social Security and they don't have much assets, it is definitely worth exploring the LIS opportunity. It'll be based on their income and their resources, but it's a much looser requirement than Medicaid. It's a broader spectrum that they look at. You have to include things like your home, your life insurance, and things like that. We'll talk a little bit more about that in a second. It's eligible to all U.S. residents, including the District of Columbia. There are some slightly different rules in Alaska and Hawaii for whatever reason, but I don't think anybody here in Illinois is too worried about that. Okay, so automatic qualification comes from anybody who's what they call dual eligible, meaning they're eligible for both Medicare and they have full Medicaid coverage. They should automatically be enrolled in LIS. You always want to make sure for a client, just to be sure, but they should automatically be enrolled. And again, you'll often hear from these folks that term extra help. If they're getting supplemental security income, Medicare eligible, they should be automatically enrolled. If they're in a state Medicare savings program, they should be automatically enrolled. You always want to make sure because we want to help these clients. Okay, what actions do automatically qualified consumers need to take in terms of requalification? If you get your purple alert each year, there's nothing you need to do. That purple alert says you are qualified for LIS, and there's nothing more you need to do. You do need to reapply for the program if you lose your Medicaid status, and that does happen. Somebody just called me this week who said they're losing Medicaid status. What do they do? Okay, so it does happen. You have to reapply. Again, the requirements are looser than they are Medicaid, so even if they lost their Medicaid status, they still may be qualified for the LIS program. Okay. And then again, with the Medicare savings programs, if you have to reapply annually, if you're in a state-run MSP program, the Medicare savings programs. What they look at in terms of income and resources, look at any wages. So if that person's still working, their Social Security income, annuities income, and support from other family members. So if you're claiming that support, I don't know who would actually do that. If I'm getting $300 from my Uncle Larry here and he's helping me out with my expenses each month, I don't know that I would be claiming that. But if you are, I guess you need to make sure that it's known. So they're looking at income and in terms of resources, in real estate that you own, not your home. So that's an important distinction. Your home value has no bearing on this or whatever equity you may have in your home. They're going to your bank accounts and cash on hand, any stocks and bonds, mutual funds, and individual retirement accounts. So they're going to take a look at your assets. Let's run through a couple of quick examples and see if some folks might be qualified and what these income levels and asset levels look like. Okay, so basically, and these are the 2015 numbers. It's based on 150% of the poverty level numbers. So an individual, the yearly gross income cannot be more than $17,655. For a couple, it's $23,895. But if you've worked in the Medicare space for a while, you'll know that there are a lot of people living on Social Security with numbers much lower than $17,000 for an individual or $24,000 for a married couple. Okay? It breaks down monthly at about $1,471 for the individual and about $1,991 for a married couple. And again, there are plenty of people out there, and you'll see some numbers on this a little later in the presentation. There are a ton of people for us to go help with this program. Okay. On the resource side, what are my assets? For an individual, it's $13,640. For a married couple, it's $27,250. And again, there are tons of people out there under those numbers. All right, let's look at an example for our friend Elena here. Okay, currently, the level for an individual, $17,655. Monthly gross income, $1,471. For her, she's currently at $1,475 of monthly income. Total assets for the program, $13,640. Elena has about $12,000 in total resources. She's right on the line with her income. She's below the line on assets. Absolutely submit that application. I'd say with about probably 98% certainty, she's going to qualify for the program. She's going to be eligible. She's going to get help. If anybody's close, absolutely submit the application. If she's got $4,000 in monthly income and $50,000 in assets, don't waste your time. But in this particular case, more likely Elena is going to be eligible for the program. Okay, let's see what we can do to help Carlos out and help him understand if he's going to be eligible for extra help. Okay, Carlos currently has Social Security income of $100. He is receiving $200 monthly in support from a family member. Okay, total monthly income currently is $1,300. That puts below the threshold of $1,471. So far, Carlos is looking pretty good here. All right, in terms of resources, Carlos owns a little lot somewhere. It's worth about $5,000. He's got about $400 in his bank account. If you have $100 cash sitting around, again, I'm not sure who would admit that they have, the couple $100 stashed under the mattress or whatever, but it's there. Okay, stocks and bonds, he's got about $2,000 worth, and $5,000 tucked away in an IRA account. So his total resources roll up to $12,500. You'll notice he does about $120,000 equity in his home. It doesn't matter. His car worth about $500. That doesn't count either. Any of your personal property, belongings, stereos, TVs, clothing, jewelry, any of that stuff does not count. And his life insurance policy does not count as an asset. So looser restrictions than what are there in the Medicare, or excuse me, the Medicaid program. Okay, total resources roll up to about $12,500. Total $13,640. So absolutely, Carlos is going to get some help here. Okay. These numbers get updated in terms of the program. So what you want to do is you need to get updated numbers. I showed you the current 2015 numbers. You can simply go to the Social Security website, do a search for the AS program, and you can find out what the new qualification levels are, because they're going to go up each year a little bit. So reached the midpoint of this morning's presentation. So at this point, I'm going to turn it over to my colleague, Larry Kassman, and let him drive us home. And again, I appreciate everybody jumping in. Hope learning something new. But this LIS program can be a lifesaver for people, so please take advantage.
Thanks, Joe. Thanks for attending this webinar. It's pretty important. The reason we're having this webinar, and it's the people help with their prescription drug coverage, but don't use it really just to, it does help with a Part D standalone drug plan, but really use it to sell people a Medicare Advantage plan. That's the benefit, because if you get them to sign up for a Part D drug plan, that means you must have a Med Sup and they're paying a high premium. And these are people with very limited income. So use it, the special element, which is all year long, to sell a Medicare Advantage plan that includes a drug plan, so they'll get the same benefits. There's no premium on the drug portion of the MAPD. If they're now there's deductibles, but the copays is the big thing. And if people are taking very expensive medications and they hit the donut hole or the gap, the way it normally works is people would pay 45% of the cost of their medication. So when you get them on this plan, they would just continue to have their copay, and some of the copays could be as little as $2 or $5. So I know my mother's on this plan, and she takes medication. Retail price is about $300, but her copay being this plan is only $5. So she pays $5 for a $300 medication, and it saves so much money. And I put her on a Medicare Advantage plan as well with a $29 premium. So that's what we should go for to sell a Medicare Advantage plan. The conversation that you'll need to determine if they qualify, they spend on average about 12.2% of their income on health, almost twice that are spent by all other consumers. Seniors living alone are more likely to be poor, like 16.5%, than those living with a family. So look for seniors. Also look for single women are in this as well. The high poverty rates were experienced by Hispanic women, 38%, and African American women, 32%. Seniors average about $4,769 in out-of-pocket expense, an increase of 46% since 2000, and it will be going up as well. So in conversation with the person, especially if they're single, find out what their situation is. People say, well, I tried to get Medicaid, I don't qualify, but the income levels are quite higher. You don't have to be on Medicaid to get this program. Average poverty rates were found in seniors who live in principal cities, 11.10% compared to the South, 10%. Over 3.6 million seniors, or 8.0%, were below the poverty level in 2011. As you break down, Caucasians 6.7, African Americans 7.6, Hispanics and Asians as well. Another 2.4 million seniors are classified as near poor with incomes between the federal poverty level and 125% above that. You saw on other slides before, they will go up to 150% above that to qualify for this plan. And like I said before, in the lower left diamond-shaped box here, older women have a higher poverty rate than older men. Assisting the consumer, accessing the application, you apply through the Social Security Administration. You can submit the application. Applications reviewed by Social Security Administration, and they'll notify if the consumer is qualified. There's a pre-application that can be submitted. You could call the phone number. They could email or fax that application to you. And you could go online if you want to do an online application that speeds up the process. Medicare Savings Program application, seeing the application, start the application process for Medicare Savings Program in the consumer states when available. Informatic, government-based information, security card, letters from Medicare, recent Social Security benefit award letters, railroad retirement benefits, and veteran benefits. These are things you need when you're filling out the application. Financial information. Your client has some tax returns, payroll slips, bank account statements such as checking, savings, certificates of deposits, if they have investments such as IRA, stocks, bonds, savings bonds, others. Receive a pension or have an annuity as income. Applicant tips. Original paper form or apply online. Enter his name and number exactly as it appears on their official document. So a lot of times people use their middle name. Make sure you put their middle name. If it's John Smith, but it goes by John Mark Smith, make sure you put middle name in there as well. With a typical name like John Smith, there could be many. So it's the middle name that will stop some of the confusion if you just put John Smith. The Consumer Security or Railroad Retirement Board number must be included as well. Do not mark both yes and no boxes in any of the sections. It's one or the other. If you mark off both boxes, the application could be withdrawn. You might have to do it all over again. Use black ink. Return the entire application package. So even if there's pages you don't have to fill out, please return all the pages. And do not send other items such as physician bills or prescription lists or IRS forms and things like that. It's not needed. And just a copy of what the application looks like. It's basic information, the applicant's name. If there's a middle initial that's used all the time, make sure you put that. Their birth, and it'll go by your junior or senior. Make sure you put that in as well. And the Social Security number is the most important thing on there. First name. If you're doing the spouse, it looks exactly the same. You can apply together. Ask you some yes or no questions. Ask you about your real estate income as well. Mark yes or no, but do not mark both. Mark no as it says right as well. Readers will ask you to combine all your total bank accounts, checking accounts, all stocks, bonds, and others. So you want to have all that ready in front of you while you fill out the application. So don't meet somebody, just have them have that ready at the table, fill it out, and they'll have it ready at hand instead of them looking in a drawer for somewhere. It just delays the process. All other questions about from resources, from sources listed, then your home and the property in which it is located, your spouse is married. Do you own any other type of real estate? They want to know that. The household, don't include yourself, but they want to know who else is living in the household as well, because you might be getting some financial assistance from somebody else in the household. And this is to verify other income. Make sure you hear every single question. Don't skip questions. It goes in more detail of what you need, but it's pretty self-explanatory, this paper application. If you go by question by question, it's easy to fill out. And then information of Medicare Savings Program. And electronic application does not require a consumer signature, but the paper one does, so make sure you do sign that. To fill out the application, the Security Administration will send a notice of approval or denial to the consumer. For electronic applications done online, the notice will be sent in 10 to 14 business days. For application, the notice will be sent 3 to 4 weeks, and it's a purple letter of approval that they will get in the mail. So set up an appointment with your client and do a follow-up with them. The day the application is submitted, set a time to call them to see if they received the purple letter. Once you've set an appointment for Medicare Advantage MAPD application. It takes a special enrollment for Medicare Advantage plan, and even if they're on that plan and they decide or if the doctor's not in the network at one point throughout the year, they can always switch to another Medicare Advantage plan. They do not have to wait till the open enrollment. The age system is so important to help your client. I mean, these people really don't know where to turn. I think the statistic was up to 40% of people may qualify.
Yeah, it's something like 36% of all Social Security Medicare eligible people are actually eligible for the program, and only about 50% of the people actually enrolled in the program that are eligible for the program. It's the number crazy. There's a lot of people out there that could benefit from this program that aren't aware of it.
So really, 36% of the seniors out there actually qualify for this program, and they don't even know. They don't know where to turn. So being advised, you could help them with the situation. And if you help them, believe me, they have friends who may be in the same situation as them, and the seniors are very good at referrals. If they like you as a broker, they will refer all their friends to you as well. You know, and the commission on Medicare Advantage plan is pretty significant. It's going to be, I believe, $423 this year, the first year. Then after that, it's over $200 years after that. So a Medicare Advantage plan is a great plan to put people on, and you're helping them. We're helping them save quite a bit of money as well. Given that we learned through this slide presentation, I hope you've a little bit identified the features and benefits of low-income subsidy program, identify the value of assisting LIS eligible consumers, recognize general criteria that may qualify for their LIS, and assist consumers in seeking candidacy for the LIS. An advisor, a lot of people say, oh, I just want to deal with a certain group of people with certain income. There's a great opportunity here for the people with low income. There's another carrier there's a woman who sells over 100 Medicare Advantage plans a year. We had an award ceremony, and he won the top one, and I believe he sold 150, the next guy sold 100, and practically all of them were for people on LIS. He targets market, he just wants to work that market. It happens to be not far from the area he lives, where people are just staying away from that market. He's indulged in it. He wants to go after those people, and he wants to do it. He wants to help these people. His friends, his neighbors' friends, they're in his neighborhood, and he's really doing by saving money. First of all, by having them go on to a Medicare Advantage plan with a zero premium or very low premium. Plus, he's helping their drug costs, because drug costs are escalating quite a bit because doctors are putting them with new medications that are brand name drugs that are very significant low pays, cost of the medication. So you're really helping people, and you're helping yourself as well.
I just wanted to jump in here. We have a slide that I thought was in here, and it's not, but we've estimated that in Chicago alone, conservatively, there are over 100,000 people eligible for LIS currently that are not enrolled in the program. And a very conservative estimate, because if you remember demographically, two of the key categories were Hispanic women, African American women. We have abundance of those in the Chicago marketplace, so that number is probably even higher. You also saw in the demographics that, these people tend to be in big cities that are eligible for the program. Last time I checked, Chicago was a pretty big city. So there are a ton of people out there currently eligible for this plan that need our help. It dovetails into what we do in a Medicare marketing workshop, but I just wanted to add that offline, because if we get into it right now, we're going to take you guys till 2 o'clock in the afternoon. But for the day, there are some very key specific places that you can target to start building your list and start targeting these low-income subsidy people. For anybody that's on the call, you'll have our contact information, of course, at the air. If you're interested in learning more and you're serious about getting involved in this space, and I would greatly encourage you to do so for 2 reasons. 1, people need the help. 2, there are not nearly enough agents helping these people in the Medicare space currently. There's a ton of opportunity out there to help people, and as Larry said earlier, to make some pretty good money for yourself. Medicare Advantage pays way better than a Medicare supplement, and it stays on the books way, way longer. You get paid for life. Medicare plans have about 96% stick rate, basically meaning once you've got somebody in a Medicare Advantage plan and they see while they work, they don't leave them. You get paid for life on that. So take advantage of this opportunity. I do have some target places that you can go after that are more clustered and serving that low-income subsidy type of individual. So there is some tremendous opportunity, and not only does it give you immediate opportunity to continue selling Medicare year-round, but you can build a database of contacts for the AEP. Maybe they're not eligible, but maybe not in the right plan for themselves either going forward. So take advantage of that opportunity. Don't miss out on it. Most importantly, and dovetails into an area I've been working on the last few weeks, is your care certification stuff. AF is already open. Blue Shield and United Healthcare have already opened up their certifications, because they're going to sell Medicare Advantage and you're going to sell prescription drug plans. You do have to be certified with AF, and you do have to be certified with the carriers. So get it done now so that you're allowed to start marketing and you sell like crazy during the AEP. I know agents that their entire living off of nothing but LIS, and when it comes to the AEP, when AEP opens up, because they've done their marketing homework up front, they have months worth of appointments booked. They can't even see anybody until mid-November, because for the first month they're already completely booked up with people to go help. Again, there's tons of opportunity out there. It's up to you to take advantage of it. Larry and I are here to help you guys do that as well. So anything that you need from us, we will help you. If you've got a big opportunity, a big event where you've been working with low-income subsidy and you need somebody else to help work the table with you, let us know. We'll come there and do it with you. So, Carrie, I get excited about this one because it's a great opportunity.
We have had an we will have marketing workshops that actually give you ideas on where to target people who are senior citizens. Joe was just talking the other day. He heard that really a great idea, especially for find out people, if they're low on subsidy, start out like at a food pantry, a local food pantry. Almost every town has a food pantry. And what type of people own it? There are usually people on fixed or low income. You might go there and say, you might be able to put up a poster, a little sign or something like that, and there's some that are actually approved for you to put on there with your name, and just ask the people working there, do you think the people here have lower income where they may need some assistance on the prescription drugs? And usually people know the people who come in for food at the pantry. And all you do is put up a little sign there, say, I'm not going to sell them something, I don't want to contact them, but here's my sign, my phone number. If you think these people might help, explain what the program is, tell them to look at that sheet that you get on the wall or the bulletin board, and say, just have the people call me. Besides trying to save money for food that they're trying to get from your food pantry, I give them on their medications. That could be a big help. And likely they will want you to help those people. So they might want you to reach out to them, but they'll be more than happy to put up that poster with your name and phone number and have the client call you so you can explain the program. So there's just one place, but there's a few others as well.
And the key to that, when you're meeting with that center director, show them the benefits of the LIS program and explain to them, look, I'm not here to sell these people anything. I help them get enrolled in this program. We've got a cause with that food pantry director. We're trying to help people that need the help, right? So why isn't she going to help you with this? I'm not going to sell them anything. If you become eligible, yes, I'm going to build a relationship with that client and hopefully enroll them in a plan that's better for them. But it's a win-win for everybody. As Larry was saying, these people are going in there, they're going for a reason. They don't have the money. You can put $3,000 a year back into their pockets. Again, that's huge. So if you just make sure that those directors understand what your purpose is, you're helping these people, and a lot of them probably aren't even aware of this program. And when you can show them the benefits of what LIS does for them, why would they want to help you? Okay? And it's just a matter of going out there and making contacts in your community. You probably already know some of these people. Just make sure they understand what the program's about, and again, why they help you with it. So,
the way to really introduce yourself, instead of saying you're an insurance salesman, say I'm a Medicare consultant. Who would turn away a consultant? I just want to help these people understand Medicare and what their options are. I'm a Medicare consultant. Don't say I'm a Medicare salesperson. It sounds frightening. People might step back a little bit, but I'm a Medicare consultant. I'll see what's available for every Medicare recipient, what their options are. And it's a good way of going about it. Just introduce yourself and say I'm a Medicare consultant. I want to help people who are Medicare, and I want to save them money any way you can. If it's Medicare hospitals, a Medicare Advantage plan, prescription drugs, I want to find a plan that I can help them the most. Informed and Connected. Upcoming events, August 6th, we're going to have a webinar on why and how to site a care. Then for people who just want to come to a place in our office, we have our conference room here. Medical certification celebration. We had this last year. We had a good turnout. We had a couple of them. It just is you need we'll probably in the morning from 9 to 2, I believe. Just so you can start, we'll show you how to start doing the AHIP certification. It's required by Blue Cross Blue Shield. With the AHIP certification, it covers the basics of Medicare. It covers fraud and abuse. And it does take a few hours. And when you complete that certification, it transfers over to the carriers. And later, you can go, let's say, on Blue Cross's website and do their certification. It only takes an hour. And this year, they only have 10 questions on their final exam. It was pretty easy. And then you can do the healthcare certification as well. So if you want to buy a place, we'll set up Wi-Fi here so you can bring your laptops. We'll give you instructions on how to get going. If you just want to concentrate, knock it out and get it done. Because a lot of times if you're in your office, you're starting, you're answering a phone call, it drags on before, the day's over, you only did like 2 parts or something like that. So if you just want to block out a few hours, come here, wipe out at least the AHIP, maybe get the program right before you do the test, or if you have time, do the test here as well. And we'll have more than one, but the first one will be August 13th.
We'll feed you.
Yeah, and we'll definitely give you a lunch. We'll give you a breakfast and lunch. August 20th, we'll have our Medicare marketing plan workshop. I like this one a lot. It really shows you how to reach out to people who are on Medicare. And that's, people say, in the local metro area, there's over 300 people a day turning 65. We'll show you and give you some ideas of where they are, so where you can find them. Find online to gain instant access to the latest industry news, carrier updates, events, invites, and flex developments, flexiblebenefit.com. We send out emails quite a bit every week. And a lot of people say, oh, the certification start. I get this every day. When I start certifying. Now the carrier sent it out. We've sent it out as well. So read all the emails. Will tell you exactly where to go to get certified. And if you lost it or deleted it, we could send you the link on how to get certified. But start as soon as you can. October's right around the corner. This is usually the slow time of the year, so get the certifications done as soon as possible. Because we really start talking about the new care plans, Medicare Advantage and Part D drug plans, starting October 1st. You can't actually take an application until October 15th, but we're already at August 1st, then 2 months later you can start selling it. So really get certified right now. I'll tell you, the Medicare Advantage is really growing. I mean, carriers are really pushing it a lot. It's very popular. It's great for people to save a lot of money. The networks, I think, are going to be expanding even more. So really, if you're a doctor and hospitals in the network, why get a Medicare supplement where you're going to pay $150 to $200 a month, where you can get very low, in some cases, zero premium. Blue Cross have a PPO, which is $66 premium. Doesn't matter what your age is, that premium is always the same. It doesn't go up. So you save them quite a bit of money on getting Medicare Advantage plans that includes the drug portion as well. We want more of the brokers to sell Medicare Advantage plans, and the carriers are going to be pushing it more. And the thing is, if these carriers are pushing it more, they'll be advertising on the radio, TV, and sending postcards and mails to your clients. So people will be asking you about, what's Medicare Advantage plan? What's this all about? So that's why you have to be certified. We showed that we had over 4,000 brokers. With flexible benefit, only 285 certified last year. Those 85, I know there's at least a handful of them, a lot of them, that are doing this Medicare, and they really don't want us to promote it to other brokers because they want to keep the business. They know how lucrative it is. But we want brokers to sell it in market. It's probably the just growing market segment there is there. So really get into Medicare. There's a lot of opportunity, and more people are turning 65. Any questions? Please give Joe or myself a phone call, 847-699-6900, or email us. We'll be more than happy to help you once you're certified. If you want to go out and meet with your client to sell a Medicare Advantage plan, if you haven't sold one before, we'll ride along with you. We'll give you some ideas. But go to our webinars and attend our seminars, and you'll learn a lot. And please feel free to call any questions you may have. You really into the Medicare market. The people, brokers, I should say, who are selling Medicare supplements, but they don't sell the Part D drug plan. So what they do, they refer their clients to me to sell a Part D drug plan. And every time the client asks me, it's their client, they're asking me, how come my broker couldn't sell me the drug plan? And I say, well, he didn't certify to do that. And the clients call me directly. Last year you sold me a Part D drug plan. What other options are out there? Because obviously my broker is certified to sell all these other plans, so could you help me? I don't steal the business. Flexibles want to steal your business. But if a client calls us directly, we have to answer their questions. We don't want to do that. We want you to take care of your client. So get certified. Don't just sell Medicare Advantage. Don't sell just a Medicare supplement. I know it's easy, but really, if you're a broker, it's either you're Medicare selling it or you're not. If you just sell Med Sup and not the Part D or Medicare Advantage plan, you don't look good in the people's eyes, and you're not going to get referrals. They want a broker they could go to, one-stop shop, to sell everything they need. So really get certified. I really beg you to do that. And
if I can jump in on that, because the one objection we always hear from brokers, and my own personal objection 10 years ago when I first started in the business, I don't want to do the certification, and it's too complicated, and it takes too much time, and blah, 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 blah. If you're selling widgets, and I told you, you would take 10 to 12 hours every year to do certifications, they twice as much on every widget you sold. Would it? Well, of course. What you have to do when it comes to certifying for the AHIP and the carrier certification. How many carriers you want to represent? You're somewhere between typically 10 and 15 hours out of your time. And again, as I said, this is the slow time of the year. It's a little bit slower right now. Get it done. You more than twice as much. And on that Medicare Advantage, it stays on the books much, much longer than Medicare sub. So, and like you said, if you're not the one offering it, somebody's just going to come in and scoop it up because the carriers are very much pushing the business to Medicare Advantage and moving away from Medicare Supplement. Backwards here in Illinois, and I know that's stunning to everybody on the call. It's about 1 right now, supplements to Medicare Advantage in Illinois. Everywhere else in the country, it's the exact opposite. It's 3-to-1 Medicare Advantage. And as an example, why is Blue Cross Blue Shield back in the Medicare Advantage game? Because you know that's the future. 80-90% of the time, it's the right solution for the client. Okay, there's still places for supplements, and I'm not only not to ever sell a supplement, you're selling yourself short and you're selling the client short if you're not offering Medicare Advantage. So off my soapbox. Really appreciate everybody jumping in today. Please reach out for us. We are here to help you any way we can to build the business. So, Larry, if you have comments, I think I'm done preaching today.
Yeah. Just a couple thoughts. A couple brokers who I met at a seminar for another carrier that sold, all they do is sell Medicare. They said, it's not just what we sell this year. Let's say a very small number. Let's say you do 10 Medicare Advantage plans. So you'll make about $4,500 one year. I'm selling 10 Medicare Advantage plans. Then second year you sell another 10. Well, you're making another $4,500, but you get another $2,200 in renewals from the first year you did, and that keeps steamrolling. And that's the thing, because it's $423 a first year, it's over $200 a second year. So really, after 3 or 4 years, you have a nice steady income of renewals, and you don't have to do anything. You can touch base with the people, see if like the Medicare Advantage plan, maybe switch plan or go to a different carrier or something like that. But usually once they're on Medicare Advantage plan, they stay on it. They like it. Their doctors in there, their hospitals in it, and they stay on it. And it's just these referrals, which are $200 a year, it steamrolls. Even if you just $210 a year, if you could do more, that's great. The one gentleman who did 150 Medicare Advantage plans last year, he says just his renewals alone, he makes over $200,000. Just the renewals. And it grows every year. It's really a market to get into. Brokers who really found it and just Medicare alone are doing great. The individuals market is changing all the time. The enrollment period this year for individual under 65 is 3 months. Group market is changing. The only market really is Medicare, because more and more people are turning 60. At 10,000, over 10,000 are turning 65 every day. Over 300 in the Chicago metro area. So the people are there, and they need your help. For your time, any questions? If you need help with anything at all, please give us a call. Try to attend as many webinars and seminars as we have. You'll learn a lot, and hopefully you could get going, and we really appreciate it. Thank you much for your time.